So welcome everybody. That's everybody in the room and the people online. I'm going to keep looking to the camera for the online, but you're all very welcome. So, as you know, we're going to be launching the serving guide today. So quite a bit of the attention is going to be focusing on serving personnel, but the title of my presentation is Suicide Bereavement in the Armed Forces Community. I want to start with an apology. Madeline mentioned before that we launched the Serving and the Veteran Guide in Westminster, the Speaker's House. These are so important, these guides. We'd managed to finish these guides, and rather than wait, we thought, let's get these out. So we launched these in April 2024, and they've been really well received. However, we leave no one behind. We still had another one to launch, and everybody matters and everybody moves forward. So for the serving guide, we had this posh event for these two, and we wanted an equally posh event for the serving guide. And so we chose today, where we've got an international audience that care about this issue. So there you go. So now we've launched the 3 guides. My team and I dedicate these guides to the armed forces community bereaved by suicide and the people that they've lost. And I want to say it's been an absolute honour to conduct this study. So before I start, I'm going to give you some kind of context, historical context, because we need to look back, we need to look where we are and where we aim to be. So, 1823, those who survived a suicide attempt was condemned to death. Government then thought, well, maybe this isn't appropriate. Maybe we shouldn't condemn them to death. So I tell you what we'll do. We'll put them in prison. This continued till 1961. Fast forward on a personal level, my brother died by suicide on the 30th of December, 1990. I don't very rarely show his face, and he never has a name, but today he's got a face and he's called Lexi. Ironically, and I didn't realise till 2 days ago, my brother was born the day suicide was decriminalised. So I want you to remember this date now as I go on. 2002, and I want to keep referring to England, and the reason why I'm referring to England, not because it's my favourite. Each country has, devolved nations have slight nuances, so I'm just going to keep it simple and just keep referring to England. 2002, the first suicide bereavement strategy was launched. And within this, they stated that those bereaved by suicide were a high priority group. So I have no doubt whatsoever there's people in this room and online they'll be questioning, why is a woman that's a civilian conducting an armed forces suicide bereavement pack? And this is why. I understand. I was wife of 24548551. I was an army wife for 8 years. I absolutely love this way of life. It was a husband that I wasn't keen on in the end. Personally bereaved by suicide. Now, I'm highlighting this in green, and it's important for everybody in this room and online to keep looking at this highlighted green. So I was based in Catterick with my husband and my little family, based in Catterick, when my civilian brother died by suicide. So I'm from a big family. I'm the eldest of 6. And I was 30, my younger sister was 12. We had nothing, nobody to support us. 33 years ago, you know, absolutely all we had was each other. And if my brother could die by suicide, well, who else in the family would die by suicide? And I know this is an absolutely, when you're bereaved by suicide, the world becomes a frightening and unpredictable place. And that is why I work in this field. So I educated myself, degree, PhD, and worked 24 years in this field. So whilst I lost my brother, whilst I was in Catterick, who was a civilian that might not be deemed important, my other brother had just finished his basic training and was learning a trade. I've experienced making the transition alone to become a civilian, not because I was bereaved, because I didn't want to be with my husband, but I had 3 children, and so I know what it's like, and I'm going to be really honest here. Civilians, we need to step up. We're not great. You know, in military life, family life and communities, absolutely everything. But coming into civilian life, I was shocked. Nobody speaks to anybody and doesn't know everyone's name. It's very difficult. So I know what that's like. So I compare my work. When I did my PhD, I was the only person in the country doing this work. Nobody was interested. You definitely wouldn't fill a room. So I compare my work to Star Trek. We go where nobody dares go. And this is like, how can I put it? There's still stigma, there's still shame. And let me tell you, whenever I'm commissioned to conduct a study, doesn't matter which study it is, I know when I accept to do the study, I'm going to get pushback. And that's every study. This study is no exception. And you know what? It's absolutely understandable because this is difficult stuff. So if I wanted an easy life, I wouldn't be doing suicide bereavement research. So when I do this work, there are many times when I agree to do something and I think, oh God, what's this? You know, many times I feel like beam me up, Scotty. But you know what? I never forget how I felt when I lost my brother. And as an academic, we have to keep going because if we don't, we'll never progress. And so this research helps to influence policy and practice. So the impact of suicide. The economic cost of each suicide in the UK is £1.7 million. We've no idea how much the economic cost is in the armed forces. That's not been done yet. 60% of this cost is attributed to those bereaved by suicide. On average, 135 people are affected by each death. I imagine it's a lot more in the armed forces, but we don't know yet. But what we do know, those bereaved by suicide, whether you're a civilian or you're in the armed forces community, if you're bereaved by suicide, you're at risk of dying by suicide. So fast forward 10 years from England's suicide prevention strategy. 10 years is like a blink of an eye in policy and practice, or it was. You know, another priority was provide better information and support to those bereaved or affected. Now, or affected is maybe the realised government. Well, maybe those people that come into contact with us or lose the patient, say, for suicide, are vulnerable. So when I say credit to government now, they're starting going about 500 mile an hour now. They're starting, you know, from the 1800s. So why do we need a suicide bereavement guide for serving personnel? So I'm going to refer to a document, MOD document 2023. So what I want to highlight is it's relatively rare, suicide in the armed forces, but I'm going to state the obvious. The bereaved always outnumber the deceased. These people live together, work together, so there's going to be more people. So there's 287 suicides in 20 years, but the impact is enormous for this population. The suicide rate is lower than the UK general population for over 35 years. Since 2017, the number of male suicides in the army have increased. The risk of suicide amongst men in the army now is the same as a UK general population for the first time since the mid-1990s. I forgot to mention my brother died when the suicide rate amongst those under 35 was going through the roof. So alarm bells should be ringing for the armed forces, and it is, to be fair. Suicide rates in the army amongst men aged 20 to 24 significantly higher than the UK general population. So whilst we've got concerns about the suicide, well, for every suicide you've got bereaved people. This is why we need the guide. So I said to you in England, 2002, excuse me, we launched our first suicide prevention strategy. Fast forward 21 years, now this is not a criticism, I'm just presenting what I see, what I know as an academic. Fast forward 21 years, UK Armed Forces Suicide Prevention Strategy and Action Plan was launched. They should be commended for this. You know, you can say, oh, it took 21 years. No, this is absolutely groundbreaking and massive. But what I would say in relation to the work that we've done, both the research and the guides have the potential. I'm expecting you to be reading this as I'm talking. Our work, we can inform and guide on 5 of the 8 focus areas. So a lot of people will describe suicide, oh, it's like a stone and it hits the water and you get a ripple effect. And that's a simple concept that everyone understands. But I tried to find a picture that would reflect what it's really like to be bereaved by suicide. Excuse me. It's not a pebble that it's the pond. It's a storm. It's absolutely a tsunami. And you can see behind, in the middle of that wave, is a little lighthouse. That lighthouse can represent a person, family, armed forces, NHS trust, school, whatever. But what I'd say to you in relation to this, if we had a storm, oh, thank you, if we had a storm like that, we'd soon be checking the foundations and the structure of the building to make sure that it continued and it was safe. The same principle applies to those bereaved by suicide. So I want to refer to the Armed Forces Covenant. The aim is to remove disadvantage and ensure that the armed forces community, including their families, receive the same support as the civilian community. So let's have a look what the civilians get. Help is at Hand. This was launched 2015. This is a brilliant document. I would recommend that you all write down this. You know, if you're a civilian, this is really important. So, if civilians are getting this, what's going on for the armed forces community? Surely they need something, and there is 3 groups within this group. You've got serving personnel, you've got veterans and families. Now, I do know at the moment, serving personnel bereaved by suicide, again, it's not a criticism, it's just a fact. They are being signposted at Help is at Hand. I would argue they need guides that are fit for purpose for them. Not one size fits all. So if you've got 3 groups, you can't just have, or can you, one guide for everyone. What we need to do is look at these 3 groups, serving, veteran and family, look at it, fine-tune it, ask, you know, and then when we've done that, we will know what these people need. And this is where we stepped up. So NHS England funded this project, and I want to acknowledge the team. So as myself, you've got Angela. Where are you, Liz? Where's Liz? Liz, just stand up, Liz, because this is Liz Cooley, and Pauline is actually online. So we conducted this study. So in relation to the study, it was funded by NHS England. Credit to MOD, they give ethical approval. This is the first study of its kind where we've interviewed serving personnel bereaved by suicide internationally. This was truly independent study. I'm bereaved by suicide, and what actually worked, and Karina referred to this, I was assigned 2 people, and it wasn't a tokenistic tick box. I had Professor Andy Bacon representing NHS Health, and Karina when she worked for the MOD. And so we met all the time, and they guided me through the whole process, which is really complex. So the aim of the study is to identify the experience and needs of individuals bereaved by the suicide of a family member, colleague, ex-colleague or friend during or after the person's military service. They were co-produced, and what I want to stress, and I've put it in red, these guides complement whatever comes out, they complement. It's really important to know that. So in simple terms, with 3 phases, we identified relevant suicide bereavement resources nationally and internationally. We conducted in-depth interviews. The findings from phase 1 and 2 inform the development of the guides. So, I'm stating the obvious, but it's important sometimes. The armed forces community, especially when they're bereaved by suicide, there is a complex web of relationships. And it's very simple, we pigeonhole everything. Serving, veterans, government departments responsible for them legally and everything, and veterans. The reality is, this armed forces community is real. And if they get to their people, and it doesn't matter whether they're veteran or serving, they will get to each other. And so this is a complex problem, you know, and so too difficult to do. No. Just because it's complex, it doesn't mean there's a complex solution. Let's ask, let's do research, let's see what they need. So I'm going to talk now about the people that died. The people that I interviewed are referring to these people. Now, these are small numbers because these are in-depth interviews. So 13 were serving personnel, 6 veterans, lowest rank to senior commissioned officers. 15 were male, 4 were female. All were white. Now, I'm deliberately ambiguous about their age to protect the family. They range from teenagers to middle age. Married, single, recently separated, 1-parent family. 2 were female from the LGBT community. Several were parents. 1 potentially part of a cluster. 2 died whilst deployed. They died between 2007 and 2022. Now, I don't talk about method, but it's important I do today. So they use similar methods as the general population, but the 2 that were deployed used firearms, access to means. And these people died where they lived, public place, etc. In relation to the people that died, we captured people that had died with Army, Navy and RAF. So 30 people took part in the study, 11 female and 19 male. Very rare in suicide bereavement research that you get more men than women taking part. 13 were serving, 6 were veterans. 11 family members, 29 were white and 1 was dual heritage. So I'm now going down now to just the serving personnel, there's 13. And some people might say, oh, 13. Trust me, these were really in-depth interviews. 12 were white, 1 dual heritage, all were male, aged between 20 and 50. Again, I'm ambiguous with the ages to protect these people. Army, Navy and RAF were represented, varied ranks from the lowest rank to commissioned officers. Several had lost more than one serving personnel, ranging between 1 and 4. So these people, let's look now at who they've lost. You've got serving person that took part in the study. Serving personnel have lost lost family member, best friends, serving and veteran, colleagues and acquaintances, patients, veterans who had recently left the armed forces. And this is really important. If someone's medically discharged, the next day they're a veteran. But to those people, when they've served with them for, say, 10, 15 years, that person dies, that affects those people, the serving personnel. And again, you see this highlighted, civilian family members. You know, some are not next of kin, but let me tell you, these people are at risk, serving personnel, so we need to be mindful of this. So what we've learned is we need 3 guides. And the reason why we need 3 guides, they're all slightly different, which is obvious, but the language they use, for example, serving personnel refer to mental fitness, whereas families talk about mental health. So in addition, we also, in these guides, refer to losing a civilian family member. 4 sections in the guides. Now, I'm not going to read the quotes. You can read them while I'm talking. So when we did these interviews, we said, you know, people bereaved by suicide are at risk of dying by suicide. Should we tell them in the guide? Every single person said, absolutely, tell us, but tell us where we need to go. So we've done that. How they might respond, you know, and these guides, we talk about emotionally, physically, and the behavioural responses, and they have quotes in the guide, you will see. Coping after suicide. Now look here, again, you've got the green highlight. He's lost several colleagues and a civilian family member that wasn't next of kin. And you know what's lovely? They say these people can't talk, because they spoke to me, many of them, for the first time, never spoken to anyone. They were doing it for their people. And you know what? They can do it. If they think they're helping the others, they'll do it, and they're an amazing job. So we've referred grief as a journey, and it's difficult, it's uphill. And that picture, I think, says it all, because potentially all those people could have lost the same person, and they all live and work together. So we create the concept of grief as a journey, like going on exercise, and you've got your Bergen, and you need to think what you need to put in it and why. Travel light, balance your load so you can respond to new terrain. And everyone has the limits. Not everybody's the same. So you need to pack well, prioritise, know your boundaries, and connect with others. So section 4, the serving guide is a shorter guide than the others. People are affected by suicide every single day, and it's devastating. And there's a lot of help out there for people. It's just finding the help. So my team and I, the effort we've gone to try and find information for serving personnel, and there's a comprehensive list of, you know, key resources and things that can help these people. Unfortunately, the MOD, and I get it, they couldn't provide information on what is provided, you know, the MOD provide, but they gave me this wording which is included in the guide. First line help is available to serving personnel internally via your chain of command and the single services which offer a wide range of professional welfare, pastoral and clinical support through their specialist staff and externally through their service charities. Mindful that serving personnel have children, or some do, a lot don't, a lot are very young. So if anyone is in relation to children bereaved by suicide in the armed forces community, I would recommend that you dip into the family guide, because there's detailed information on how to respond. So these guides are informed by lived experience and high quality research, theory and practice. Ultimately, they're written by the bereaved for the bereaved. These guides are nothing like an MOD document or an NHS document. I make no apologies for that. These have been designed with the help of the armed forces community. And if you want to know what the armed forces community, if it's real and what it's like, these guides demonstrate this. Not only did they take part in a study and talk about stuff they struggled with, others provided photographs, and even more than that. And these photographs are for the people that need these guides. Seeing people that look like them is really important and help to reduce the stigma. But more than that, some of these also give photos of the family for their people. So these guides, they acknowledge the difficulties these people face, reassure, inform, guide, signpost, empower, but ultimately generate hope and have the potential to save lives. So these guides are creating a tsunami of hope and expectations. The armed forces community, bereaved by suicide, are finding the collective voice. They no longer want to be invisible, and they hope that sharing their vulnerabilities and needs will influence change. So what next? We're going to, the findings and the guides have the potential to influence policy and practice. We will publish in academic journals. We're launching armed forces responding to suicide training for the armed forces community today, which is evidence-based and again, first of its kind internationally. And this will help increase the confidence and skills responding to those bereaved by suicide in the armed forces community. So, we're at this point now. We've launched all 3 guides now, and let me tell you, it's not been easy, really not been easy. And so, our team have got it to this point now, and it's almost like passing a baton. And this is where we need your help. We've got the 3 guides. It's the armed forces community, and I know you'll do it, and I know you'll help, and I know you'll spread the word, because that's what you're so good at. So can I ask that all of you, I know there's some people here that put the link under the email signature, you know, share lots of things. If we've got a board here, if there's something you can think that we should be doing to help disseminate the guides, or something you're going to commit to, please would you write it on there, and those online, if you can write it in the chat, so that way we can look and it can guide us. And do you know what? It'd be a bit of a morale thing for us if we know that, you know, they're not going to be sat on a shelf. So I would like to thank NHS England for funding the study, MOD for providing ethical approval, enabling us to conduct the first study with serving personnel bereaved by suicide. His Royal Highness, the Prince of Wales for writing the, His Royal Highness, Prince of Wales for writing the foreword. And last, definitely not least, the Armed Forces community that supported our team, helped to recruit, took part in the study, provided photos, and they've reviewed the guides. And I would say a combination of all of that, the funding, ethical approval, the armed forces community, I think these guides demonstrate that together we can make a difference. Thank you.